बिस्मिल्लाहिर्रहमानिर्रहीम। साईं सदाई करी मथे सिन सुकार, साईं सदाई करी मथे सिन सुकार, दोस्त मिठा दिलदार आलम सब आबाद करें। बिस्मिल्लाहिर्रहमानिर्रहीम। Ladies and gentlemen, Assalamu alaikum and a very good morning. Warm welcome to all of you on this second day, our first International Nursing Research Conference under the theme of A Voice to Teach, Invest and Respect, Healthcare Professionals to Secure Global Health. And this is being organized by People's Nursing School, Dhaka University of Medical and Health Sciences, Jamshur. I'm Dr. Gulzar Usman, Associate Professor of Community Medicine Lungs, and
I am Asma Kama, visiting lecturer at People Nursing School.
So some highlights of the day. We have a couple of keynote speakers which will come live on Microsoft team meeting, and then we have a very well-known personality, a great motivational speaker, Professor Dr. Abdul Majid Chaudhary Saab, and then we have precious personalities who did great contribution for promotion of nurses and nursing field, and they will share their valuable experiences. Then we have oral and poster presentations as well. So a lot of things are coming in today's session. So without delaying more,
तलाशे इल्म में तू पहुँच गया कहाँ से कहाँ तक जहान में, तलाशे इल्म तू पहुँच गया कहाँ से कहाँ तक जहान में, बता तो सही वो कौन सा सबक है जो खुदा ने नहीं दिया कुरान में. With this, nothing can be started without the remembrance of Almighty Allah, who is the most beneficent and ever merciful. Without any further delay, I would like to call Ms. Dua Chandu to recite some verses from Holy Quran. Ms. Dua Chandu.
خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان والأرض وضعها للأنام فيها فاكهة والنخل ذات الأكمام والحب ذو العصف والريحان فبأي آلاء ربكما تكذبان خلق الإنسان من صلصال كالفخر وخلق الجان من مأرج من نير فبأي آلاء ربكما تكذبان صدق الله العظيم.
सुभान अल्लाह, जज़ाकल्लाह मिस दुआ चारियो। कि मोहम्मद से वफ़ा तूने तो हम तेरे हैं, कि मोहम्मद से वफ़ा तूने तो हम तेरे हैं, ये जहाँ चीज़ है क्या लोहो कलम तेरे हैं. Now I would like to call Miss Hina Kamal second year BS Nursing student of People's Nursing School LUMHS for Naate Rasool Maqbool Sallallahu Ta'ala Alaihi Wasallam, Ms. Hina Kamal.
इश्क़ मुस्तफ़ा जिसके सीने में है, इश्क़ मुस्तफ़ा जिसके सीने में है, कहीं भी रहे वो मदीने में है, कहीं सल्लल्लाहु अलैका या रसूल अल्लाह वसल्लम अलैका या हबीब अल्लाह। दरे नबी पड़ी रहूंगी, पड़े ही रहने से काम होगा, कभी तो किस्मत खुलेगी मेरी, कभी तो मेरा सलाम होगा, कभी तो किस्मत खुलेगी मेरी, कभी तो मेरा सलाम होगा। खिलाफ़े माशूक कुछ हुआ है, ना कोई आशिक से काम होगा, खिलाफ़े माशूक कुछ हुआ है, ना कोई आशिक से काम होगा, खुदा भी होगा इधर भी है दिल, जिधर वो आली मकाम होगा, दरे नबी पर पड़ी रहूंगी, पड़े ही रहने से काम होगा, किए ही जाऊंगी अर्ज़े मतलब, मिलेगा जब तक ना दिल का मतलब, किए ही जाऊंगी अर्ज़े मतलब, मिलेगा जब तक ना दिल का मतलब, नशा में सुबह की मतलब होगी, नए फसाना तमाम होगा। दरे नबी पर पड़ी रहूँगी, पड़े ही रहने से काम होगा, कभी तो किस्मत खुलेगी मेरी, कभी तो मेरा सलाम होगा।
Subhanallah. Thank you very much, Hena. I am Fatma Sumro, lecturer, People's Nursing School. We are going live on LUMHS FM and LUMHS TV. ए मेरे वतन तेज़ कदम हो, ए मेरे वतन तेज़ कदम हो, फिर तुझसे मिलाए वो कदम जिसमें के दम हो. With these lines, I request you all to please stand up for the national anthem.
I, Shafaq Nas, final year DPT student, on behalf of whole NRCON team, we are very immensely happy to welcome you all at the second day of First International Nursing Research Conference 2022. We, along with our NRCON team, are delighted and honored to have you all with us. We are very much honored to have the chief guest and chief patron of this conference, Professor Dr. Ikramuddin Ujar, worthy Vice Chancellor, LUMHS University, Jamshoro, and guest of honor, Dr. Shazia Sobia Shumru, President, Nursing Council, Islamabad, accompanied by Assistant Registrar, Pakistan Nursing Council, Mr. Mushtaq Shumru. I also want to warmly welcome our renowned motivational speaker, Professor Dr. Abdul Majid Chaudhry Sahab. We are very much thankful to all our honorable guests, keynote speakers, distinguished guests, all dean, director, and faculty members of LUMHS, and head of departments of all nursing institutions who took part in this conference and make it more valuable.
Thank you, Shafa. ये दुनिया आखिर फ़ानी है, ये दुनिया आखिर फ़ानी है और जान भी एक दिन जानी है, और जान भी एक दिन जानी है, फिर तुझको क्यों है रानी है, फिर तुझको क्यों है रानी है, कर डाल जो दिल में ठानी है, उठ बांध कमर क्यों डरता है, फिर देख खुदा क्या करता है. These lines are dedicated to the chief organizer of this conference, Director People's Nursing School, Miss Parveen Akhtar, and her entire team. She thought, she did, and she achieved. Alhamdulillah. Please put your hands together for Madam Parveen, Chief Organizer of this conference, Director People's Nursing School, and her entire team for organizing such a successful conference. Please give all of them a huge round of applause. Now I request Ms. Parveen Akhtar to please kindly escort our honorable guest to the stage, including our motivational speaker, Professor Dr. Abdul Majid Chaudhary. Please give them a huge round of applause. With Dr. Muzaffar Sheikh and our respected guests are here. Dr. Pamela Marshall, please give ma'am big hands. Ladies and gentlemen, I am not hearing sound of applause. Please give all of them huge applause. And our guest, Alia Nasir, ma'am, please come on stage. Please give all of them once again huge round of applause.
Thank you so much all. Have a huge round of applause for distinguished dignitaries. Have a huge round of applause for distinguished dignitaries. हजार बर्क गिरें, लाख आंधियाँ उठें, हजार बर्क गिरें, लाख आंधियाँ उठें, वो फूल खिल के रहेंगे जो खिलने वाले हैं. I would now request Madam Victoria Summer, Assistant Professor, People Nursing School, to please come up on the stage and deliver her welcome note. Huge round of applause for Madam Victoria.
Thank you, Ms. Shafak. Dear colleagues, deans, professors, principals, researchers, ladies and gentlemen, a very good morning and assalamu alaikum to you. On behalf of People's Nursing School, Liaquat University of Medical and Health Sciences, I would like to extend my sincerest gratitude and welcome you to the first International Nursing Research Conference 2022. Moreover, extending my gratitude, I honorably welcome our chief guest and the great visionary man, Professor Dr. Ikramdeen Ujjan, worthy Vice Chancellor, Liaquat University of Medical and Health Sciences. Guest of honor, Dr. Shazia Sobia Sumro, President, Pakistan Nursing Council, and member of National Assembly, and our motivational speaker, Professor Dr. Abdul Majid Chaudhary. Furthermore, notable keynote and invited speakers includes Ms. Veronica John from Sydney, Australia, Professor Dr. Vepeda Vitakul from Bangkok. They will be joining us on Zoom. And our in-house speakers, Dr. Pamela Marshall, welcome you, ma'am. Nursing Dean, Ziauddin University, College of Nursing, Karachi. Associate Dean, Dr. Tazeen Ali, from Aga Khan University, Karachi, and Ms. Alia Nasir, Principal, College of Nursing, Hamdard University, Karachi. Thank you for honoring us with your presence. It is my hope that the first International Nursing Research Conference 2022 would be able to achieve its objectives in providing an effective forum for academicians, researchers, and the humanity for advancing knowledge, research, and technology for humanity. Nursing research plays an integral role of influencing current and future practitioners, thus making it an important educational component to be considered. Apart from being one of the fast evolving disciplines, there are new and emerging responsibilities that nurses are required to handle. Some of them includes home health care, business sector, laboratory, and the community health department. Although these settings have different responsibilities, the primary role of the nurses is to act as advocates to the clients for optimal care is provided. Nursing is not a business, but a practice with a human touch. Thus, being a nurse is being human. I think nursing research is quite important because it facilitates the growth and expansion of the field, hence paves off for optimal care, and optimal cares lead to the better life. As we can together as nurses and healthcare providers are striving day to day to provide humanity, and no matter how much we can accomplish until we can as one alone. As proud nurses and the healthcare providers. Therefore, the focal drive of this conference is to exchange ideas. And by participating in this exchange, it is hoped that all parties who may benefit from this conference can apply it in managing activities in their areas. It is also pleasing to note that the agenda of this conference covers a wide range of interesting topics related to all theoretical and practical aspects, but not limited to nursing alone. And finally, I would acknowledge a remarkable work of Chief Organizer, Ms. Parveen Akhtar. Thank you, ma'am. Mr. Amanullah Rin, and the reluctant efforts of volunteers and my team directly and indirectly contributing towards the success of this conference. The team has organized a vibrant scientific program and is working hard to present highly respected and internationally renowned speakers to lead it. Although we try our finest to the professionals, on behalf of Liaquat University of Medical and Health Sciences, please accept our sincere apologies should be there any inconvenience that occur before, during, or after the event. I wish you a very productive conference with exciting and encouraging discussions an exchange of knowledge, so that together we can anticipate a future of groundbreaking knowledge, research, and the technology for humanities. May God bless us all with good health to make this event successful and enjoyable. Thank you.
Thank you so much, ma'am. Now, we have live sessions with 2 keynote speakers connected on Microsoft Teams. First talk will be delivered by Ms. Veronica John. She is from Sydney, Australia. Currently, she is working as a consultant in her advisory capacity on organizations' team performance and clinical compliance. She has done BS Nursing from Aga Khan University, School of Nursing, Masters of Nursing in Clinical and Teaching Education. She has received many more awards. Let's connect her and let's listen from her further. Please give huge round of applause of her. She is live from so far.
Ms. Veronica is just joining through this Google Team Meet. So please wait. We are in process of connecting with her, and she will be connecting soon. I will have a scholarly talk from her, and then another speaker will also join us through this app. And after that, we have a great personality, a great motivational speaker, and a lot of things to introduce him. So we'll listen from a lot, inshallah, and none other than Professor Dr. Abdul Majid Chaudhry Saab. He is here, and he has come all the way from Lahore. And a huge round of applause for Sir Professor Dr. Abdul Majid Chaudhry Saab. So I will introduce him in detail when we'll be finishing with this session online. So just in a couple of minutes, inshallah, we are starting. And yesterday's session and today's session, these both days of this conference are being covered by LUMHS TV as well. So, sir, we have our own web channel as well as FM radio, that's campus radio. So, this whole event is being broadcasted live through these both channels. So, and you guys can go through after even completion of this conclusion session and search our LUMHS web TV on Google, and then you will find this whole program, this whole recording over there. So just in a minute or two, we are going to connect with Miss Veronica from Sydney. सर हम चाहते हैं कि आपको सर अब्दुल मजीद साहब, हम चाहते हैं कि आपको सिंध के जो बड़े शायर हैं शाह अब्दुल लतीफ़ भिटाई रहमतुल्लाह अलैह, उनके एक शेर से आपको मुखातिब हों कि माण्हू सभु न सुहिणा पखी सभु न हंज, माण्हू सभु न सुहिणा पखी सभु न हंज, कंहिं कंहिं माण्हू मंझि अचे बूअ बहार जी। वैसे तो सब लोग खूबसूरत होते हैं और सारे परिंदे भी खूबसूरत होते हैं, लेकिन जो चीज़ किसी शख्स में जो खुशबू होती है वो सब में नहीं होती। एक्चुअली इसका जो है वो ट्रांसलेशन इस तरह से है। सो मिस वेरोनिका इज़ हियर एंड ओवर टू हर।
I request you all to please keep silence and to listen her. She is here for all of us, so please kindly, it's just a request that please listen to her carefully.
Imdad. Sorry? Oh, okay. Hi, good morning, everyone. I want to thank Parveen Imdad for inviting me to speak at this conference. And I'd like to thank them for their attention. They are strong and resilient, talented, have adapted abilities and capabilities. They're creative and resourceful. But unfortunately, we do have severe gaps in the healthcare system, which is but in this global healthcare crisis, nurses have become depleted, and with a heavy load to bear, they have exacerbated over a period of time and are showing signs of buckling under the pressure. So through COVID, it was seen as unprecedented, never seen before, but the global nursing shortage has been a red flag for many years. After the pandemic, we do hear that now we live in a new normal. But what is that normal? Meaning that that new normal is living with COVID and continuing on. But there is nothing new about this new normal because our battles are the same old healthcare challenges, the same nursing shortage. So when we say it's a voice to lead, we ask the governments and the non-government agencies to be the voice to lead with us as nurses for an urgent investment by them to continue professional development and education for nurses so that we can remain in the workforce and produce leadership of quality. So when we say we want to lead, a voice to lead, we want to lead into action on global nursing shortage and an aging workforce. We want to lead on supporting high standards in nursing education, and we want to lead in recognizing leadership at top government and non-government levels. So with my first point, I urge employers and agencies to support continuing professional development of nursing as value investment in nursing in healthcare. So if they're investing in healthcare, they are actually investing in nursing, because nurses are the heart of healthcare. Consistently investing in nursing and development will allow retention of nurses and future choice of the young generation for nursing as a career. High education and continuing professional development of nursing will also ensure high pay and create job opportunities in line with best practice and advanced technologies. We know that we are building professional bodies, and with that, we can ask for a culture of support for professional study leave, scholarships, and partnership for further career developments for new and current graduates. We also know that when we ally competency-based education, which is contextual and culturally specific to current and forecasted future healthcare issues, the education is really based on what is being done into the ground level in the healthcare setting. We ask for partnerships with families and social workers and carers to promote person-centered care for home nursing with PHC nurses, primary healthcare nurses. And we have seen the data that now many patients and consumers want nursing done at home, and they are capable of having that ability to be cared in their homes. We also know that virtual healthcare, telehealth consultations were a buzzword during the pandemic, and this has become a valuable source for those with limited access in remote areas and where there is less nursing workforce available. In supporting high standards in nursing education, we also are working or want to lead in education standards that are aligned with accreditation standards, regulation and accreditation of education institutes themselves to uphold the high standards of quality education. If you were to ask me if there was ever an essential resource in healthcare and what is that essential healthcare resource, I will always say it's the workforce. The healthcare wheel stops if there is no healthcare workers. With review of regulation to admission criteria in nursing at the entry level, we ask the registration process for nurse, graduate, and postgraduate levels be simplified, which will allow streamlined flow of admissions. For nurses to be empowered, these standards, they have to be aligned as well with curriculum that is effective, technology that is accessible, and nursing programs that have courses which are saving and which are actually facing the current needs of educational standards. We need financial and budgeting and policy making courses so that our nursing students understand from the very beginning what financial implication, budgeting, forecast, and policy making, decision making is when they go into the workforce or the work field, into hospitals, nursing homes, and clinics. We also ask if multi-career pathways, dual healthcare and arts degree, for example, a psychology degree with a nursing degree, or communications degree with a nursing degree, or social worker degree with nursing degree would help and give that skill mix, which is going to be attractive for wider choice and selection to attract new graduates into the profession. We also want to recognize those mature age students who want to come into the healthcare nursing education, that there would be recognition of prior learning for acceleration of the program to make it fast-tracked for them. And for education pathways, so that a minimum period of service promotion will be available. For example, if there is a minimum period of service in the local community or public health sector, rural or remote community before moving on to urban jobs, to allow service access to these areas. Social media has always played a very important role in occupations and professions to either demote them or promote them. And in this case, we ask that social media platforms be educated to remove social and cultural nursing perception. The negative impact that it has on the admissions process and career choices is very vast. So also investing in advanced digital technologies in nursing institutions so that we can train our faculty to use that technology and have high standards of university education for them. This one, which is really close to my heart, is recognition of advanced nurse practice contribution, because in this we recognize that the burden of healthcare nurses will be reduced if advanced nurse practitioners' turf challenges are realized, where they are given legislative access to full practice within their scope of practice and not be limited or restricted in their practice, and positively inspiring them to continue to improve in their practice. We also ask nurse researchers, teachers, advanced care practice faculty support in tertiary we have a clear roadmap for how we recruit them and how we help them in their careers and retain them in the workforce. And of course, increased pay and non-financial incentive is one that is really important for the nurses to have the value and contribution that they provide in the healthcare. So the third point that I have put in here is nurse leaders be recognized and influenced at government and board level. Now, this is a stark realization, because overall, as you can see here, women represent 70% of the global health force and only 25 in leadership positions. And the sad part is down at the bottom with ICN survey saying 1 in 4 national nursing associations reported that high-level decision-making during the pandemic, the nurse leaders were not involved in it. Also, 2 in 5 national nursing associations reported that specialized nursing, infection prevention and control nurses were not involved in the policy and plans for infection control. And the whole world was going through this, and nurses were not involved in basic infection prevention and control policy making. This is again a stark reminder that we need to do a lot to get to have a seat at the table, at the decision-making power. So nurse leadership is as important to the delivery of quality healthcare as technical skills at the bedside. I really like this statement that's taken from the International Council of Nursing on page 8. And this speaks so much that the nursing leadership is just as important as the delivery of care at the bedside. Nurse leaders need to be recognized. The policies that affect healthcare are not always healthcare policies alone. There is so much going on behind the scenes for healthcare policies, because everything affects healthcare policy, the environment, the disasters that we face, the other neighboring countries, whatever their situation is, everything affects our policies. So it is warranted that nursing leadership have a seat at the table to influence board and decision making. And nurse leadership at the top level, we are sure as nurses that we will make a difference because we are the end users of that policy. So if we have a hand in when the policy is being made, definitely the policy will be effective and safe for healthcare use. So we also need to influence social contributors on, like I said, social platforms, political platforms, and at top government levels. Because we know that we are well-informed leaders, we are educated, and our decision-making is based on evidence and experience, and will definitely make a difference at the top level. So, as I was informed, Australia's action towards global health and workforce shortage is definitely the same like Pakistan. Australia also has shortage of nurses, and our main concern here is also the lack of retention of nurses. So if you see over here that Australia will have a shortfall of nurses of 100,000 by 2025 and 123,000 by 2030. So the focus strategy to remedy for Australia is policy and strategy. Now, this policy and strategy is really important because it is a national nursing strategy to assist nurses and midwives to work to the full scope of practice. Nurse practitioners, nursing education. Nursing education, an independent review is So there's another one with the nursing workforce projections till 2030. These projections are developed for long-term national workforce projections so that any weak areas, they will be mitigated and actioned beforehand before they come into a disaster steps. The cost-benefit analysis for nurse practitioners is being conducted at the moment because they really want to have a look at how the nurse practitioner model of care will work for them and how then they can expand this nurse practitioner model. Poor retention, as burnout is one of the key factors where nurses are leaving, and like Pakistan, Australia is also working very hard towards reducing this workforce burnout by free confidential mental health consultations and other well-being incentives. And I think it's high time that the world recognizes that nurses do have superpowers, but at the end of the day, they're humans themselves. So transition to nursing practice. This one is also another program, which is evidence-based education program that supports the primary healthcare nursing. And it also helps to improve the recruitment and retention of the primary healthcare nurses because it wants the primary health nurses to be working in home care and then have less burden into clinics and hospitals. Nurse-patient ratios, they continue to lobby for nurse-patient ratios in nursing homes. Over here, strengthening of health security for Australia's global health contribution was in the Pacific and Southeast Asia because that's the neighboring countries, and Australia also has other global projects from preventative diseases, assisting them and strengthening them, and also in universal health cover for basic services, health services to the Southeast Asian countries. Australia is very active also in women and girls' sexual and reproductive health, and also priority and sustainable developments for prevention and control of non-communicable diseases. So these projects and these global health goals are really big and important, but we like Pakistan, we are also working at breaking them down into bite-sized pieces so that we can work at them one at a time and get momentum into addressing nursing shortage and the aging workforce. Thank you.
Thank you so much, Ms. Veronica John from Sydney, for being with us and sharing your valuable experiences. We are delighted to have you with us, and a huge round of applause for her again. We have another keynote speaker. She will also join online. But before that, I would like to extend our gratitudes to our special guests. And I'll take a verse from Sindhi poetry to welcome those special guests. Aya asathyam baro cha bambhore me. Aya asathyam baro cha bambhore me. Pasi pahar punuaji. No se nena tharyam. Gundar visryam. Sukhan shaku mukyum. So on behalf of the Chief Organizer and Director, People's Nursing School, Madam Parveen Akhtar, and whole faculty of PNS, LUMHS, and the team of NRCON 2022, we welcome warmly to Madam Dr. Shazia Sobia Sumro, the President of Pakistan Nursing Council. Thank you very much, ma'am, for coming and joining us. Along with her, we have another special guest, Mr. Mushtaq Ahmed Sumro, Assistant Registrar, Pakistan Nursing Council, Islamabad. Thank you so much for being with us, and it's really great honor, and indeed we are feeling pleasure to have you both here. Thank you very much again, madam. We have another guest of honor, Mr. Shabir Hussain Jhatyal Sahab. Sir, thank you very much for joining us. He has also come all the way from Karachi. He's Director Nursing Sindh. He has remained, and he'll also deliver his talk later on. So we are going to connect with another keynote speaker through online. Madam Rubina Shah, the Controller of Examination, Nursing Board, Karachi. Madam, we also welcome you from core of heart. Thank you very much. जब तक कि हम कनेक्ट हो जाते हैं हमारे दूसरे गेस्ट स्पीकर जो हमारे मोअज़्ज़िज़ मेहमानान जिन्होंने आज हमें ज्वाइन किया है, मैं उन्हें ये बताते हुए खुशी महसूस करूंगा कि कल हमारी इस फर्स्ट इंटरनेशनल नर्सिंग रिसर्च कॉन्फ्रेंस का inaugural session tha, and that was also great, and today is the second and last concluding day of this conference, and this conference is being participated by almost all the organizations and institutions of nursing fraternity throughout the Sindh. We have participants from Karachi, Hyderabad, and other cities, so huge round of applause for those participants, their faculty and students. And we are also going online through our LUMHS web TV. ये दोनों दिनों की नशरियात जो है वो लाइव नशर की जा रही हैं, और प्रोग्राम के बाद भी आप इसे फाइंड कर सकते हैं LUMHS के ऑफिशियल वेब पेज पे, वेब टीवी LUMHS. आज के दिन में we are just waiting for connection with the other keynote speaker, and she'll be joining us soon in few minutes. आज के program में we have keynote speakers, then a motivational speaker, and a great name of our medical fraternity, Professor Abdul Majid Chaudhary Sahab. We'll listen him, and after that we'll have a tea break. और टी ब्रेक के दौरान ओरल एंड पोस्टर प्रेजेंटेशंस भी आप उनका भी मुआयना कर सकेंगे. और आफ्टर दैट वी हैव 2 प्लेनरी सेशंस. 2 प्लेनरी सेशंस हैं हमारे, जिसमें मुख्तलिफ स्कॉलर्स अपने पेपर प्रेजेंट करेंगे. और 2 हॉल्स, एक हॉल 1 यहीं लतीफ़ हॉल, और दूसरा हमारे अप स्टेयर्स मेडिकल एजुकेशन का हॉल है, हॉल 2. तो आप तमाम पार्टिसिपेंट्स जो है वो इन दोनों जगहों पे जाके हमारे ये पेपर प्रेजेंटेशंस और प्लेनरी सेशन सुन सकते हैं. एंड देन वी विल बी कंक्लूडिंग द सेशन एज वेल एज दिस कॉन्फ्रेंस. कल से जितने हमारे डिस्टिंग्विश्ड गेस्ट्स आए हैं और उनकी जो हमने स्कॉलरली टॉक सुनी है, जो डिस्कशन हुआ है, वो यकीनन हमारे नर्सिंग के शोबे के लिए एक बहुत ही हौसला अफजा बात है. और इंशाल्लाह ये पेपर्स और ये रिसर्च का जो कल्चर है वो यकीनन हमारे इस शोबे के लिए बहुत कारआमद होगा. और ख़ास तौर पे जो हमारे यंगर्स और अपकमिंग नर्सिंग फेलोज़ हैं, उनके लिए बहुत कुछ सीखने को उनको मिला है. और इंशाल्लाह इट विल कंट्रीब्यूट इन देयर करियर एंड प्रोफेशनल लाइव्स. And today we have the president of Pakistan Nursing Council, so it's also a great occasion. मैडम से भी हम यकीनन सुनेंगे और words of wisdom, and that will be also a great message for you all participants. So just wait for a couple of minutes, and we are connecting with another speaker. Let me introduce her, the second speaker. She is Professor Dr. Vepeda Kunavekatkul from Bangkok. She is a professor and Dean Faculty of Nursing at Chiang Mai University, Thailand. She has done research fellowship from Harvard University School of Public Health, USA, and she has done her PhD in Nursing Service Administration from USA. She has also earned a degree M.Ed. Nursing Administration from Thailand, and BSc in Nursing and Certificate in Midwifery from Chiang Mai University, Thailand. She has worked at different positions, such as Director, WHO, collaborating for nursing and midwifery, and many more. So see, having such huge profile and multi-dimensional, competences, so these scholarly, talks and these lectures are worth to listen, worth to attend. So you are lucky to be here and to listen from these iconic personalities, not from Pakistan, but as well as from abroad. So Ms. Vepeda is just in process of connection. She will be joining online. So just wait for a couple of minutes and she'll be joining. Thank you very much.
I just want to welcome all of you who are just joining us. And on the behalf of People's Nursing School, Liaquat University of Medical and Health Sciences, Shamchoro, I would like to again special thanks to our director and the chief organizer of this conference, Ms. Parveen Akhtar, with your huge round of applause. Ladies and gentlemen, I just want to tell you that this is the first ever International Nursing Research Conference. Nursing Research Conference, which is conducting the People Nursing School LUMHS Jamshoro. So we are all together here. Please kindly give all of us big hands, including you. We are also very much thankful to all of our nursing affiliated colleges which are affiliated with LUMHS. We are very much grateful for their participation. Please give all of them a huge round of applause. And none other than our president is here of Pakistan Nursing Council. I request all of students, please stand up and give her big hands. Because she is president of Pakistan Nursing Council, please, all of you are requested to stand up and give her a warm welcome. We have another guest speaker, Ma'am Pamela Marshall. She is professor and also Dr. Ziauddin University, principal. Dean, Ziauddin University. Please, kind, huge round of applause.
We welcome Professor Vepeda from Bangkok. She has joined, but we are just...
Yes, yeah, some. Let me see. Do you see the PowerPoint? Let me share the slide share. Do you see me? Okay. Can I start now? Yeah. Okay, good afternoon, everyone. You see me? Okay. Okay, so good afternoon, everyone. First of all, I just would like to thank the organizing committee introduced me to this conference. So my topic gonna be global health and nursing role in the 21st century. Vepeda Kunavitikun from Panyapiwat Institute of Management in Thailand and School of Nursing. Today is a pleasure for me to talk to you. So as I have only 10 minutes, so I'm gonna talk about a little bit fast and also talk about globalization and changes and also global health and nursing roles in the 21st century and in conclusion. As we all know that the global changes has so many things that changes all the time. And so we know that it like globalization and international trade, displacement of population, global warming, emergence and new diseases, and also medication resistant biotourism. This is some of the changes. But anyway, so these changes occur all around all this every minute or every second. So this world is like we call VUCA world and changes all around the world because we don't know that what's gonna happen. So it's like volatility and also uncertainty and complexity and also ambiguity. So the society is sometimes it has brittle and people are anxious and also it's not just linear. So it's non-linear and incomprehensible. Sometimes we cannot predict what's going to happen. So health and demographic data is also one of the changes now, and also advanced technology and also healthcare technology. And we also have some of the demographic data that decrease the birth rate and mortality rate in many countries, and more elderly people. And in 2039 gonna be 1/5 of world population, or more than 10,000 million people will be elder. And like in Thailand also, from 2023 will be 1 million elderly each year, and also in 2039 gonna be like will be 20 million elderly people. Thailand is not a big country, it's only 69 of population, so the birth rate is also decreased, and it's going to be like a very low, like a 2.2 only. So this is a big issues in Thailand, so we have to take care of the elderly too, and nursing profession also have to take care of them too. And we also face with COVID-19. I think that every world faced with this thing. So this kind of changes and trend is like a healthcare disruptive. We have a lot of using technology, digital healthcare, never happened before. Like I believe that in Pakistan also the same thing. We have like wireless health, we have mobile health, telehealth, and also electronic health record. That is a lot. There's a lot of changes during this time. Also, we have like a robot help us. So what should we do next to make it a global health? So this changes technology, digital world, elderly, society, and pandemics. So we concern more in terms of global health and nursing roles. So what is global health? If we think about health, WHO also propose that health is a state of complete physical, mental, social, and spiritual well-being, not merely an absence of disease and infirmity. So this is like they proposed a long time ago, more than 30 years ago, that health for all by the year 2000, but it's not happened yet. So global health is an important term and important concept, because health problems, health issue, and concern that transcend national boundaries and may be influenced by circumstances or experiences in other countries, and best addressed by cooperation, action, and solution. So this is proposed, the concept of global health, by IOM, or Institute of Medicine. So this is like you see that some of you may see this and some may not see this. There's a lot of health problems in many countries around the world. So this is like what's happened, and we face with this kind of things in the COVID-19 that is a very big issues in Thailand. So in terms of what should we do, and actually we take care of the patient. We are the same as in other disciplines. Nursing, medicine, public health is like a part of the same health and also health profession. So I think that the same goal is to provide quality of care. So we have to work together in the multidisciplinary team. There are many changes in global health with different professional emphasis in different diseases. And this one, that's what I say, that interprofessional approaches are needed to ease the burden of both communicable and non-communicable disease. So if we talk about the key concept in relation to global health, there are so many things like determinants of health. So we measure with the determinants of health, the measurement of health status, the importance of culture and health, or the global burden of disease, also the key risk factor for various health problems, or even the organization and function of health system. So global health always relate to health system. So there's a lot of opportunities and challenges like so we we do many countries, I think that include Thailand, also Pakistan, or do healthcare reform that focus on efficiency, quality, accessibility, health equity, and universal health coverage, something. So this is a long time ago, but still, we still need to do more in terms of quality and safety. That is a focus of healthcare now. And health workforce is also because we don't have enough health profession who work in the care system, and also not just care system. So we need to, this is around the world too in terms of health workforce. It's like a shortage of health profession, include nurses too. And the other thing is also in terms of socio-economic gap and demographic background of the population. These changes are both opportunities and challenges too for all. As I think that all of you know, UN Millennium Development Goal, if we talked about global health, we always talk about MDG in the past, like since 2000 that they proposed about MDG and proposed that it should be achieve the goal in 2015, 15 years. And UN Millennium Development Goal focus on eradicate extremely poverty and hunger, and also achieve universal primary education, promote gender equality, and empower women, and also reduce child mortality, improve maternal health, and combat HIV/AIDS. That because that time there still be issues of HIV/AIDS, malaria, and other diseases. And also they propose that we have to ensure environmental sustainability and develop the global partnership for development. So these are the MDG that they proposed in 2000. But anyway, in 2015, they still need to do more in terms of SDG. I believe that all of you know about SDG because they proposed that 2013 we should have like a sustainable development goal achieved. So there are 17 goals altogether. And as we are healthcare profession, we all always focus on number 3, good health and well-being, right? But anyway, I think that many of the goals have the relationship too. So this is like a health-related sustainable development goal. This is like I already talked about that there are 17 goals, right? And goal 3, ensure healthy lives and promote well-being for all of our stage, but it's relevant to other goals too. So the SDG also build on achievement of MDG, but are broader, deeper, and far more ambitious of their scope. So what will we do? And the goal integrate many aspects of our works in building resilient health system and effective health institute for sustainable and equitable health outcome to ensure no one is left behind. So this is like a goal. So WHO, our World Health Organization, leadership priorities also propose that universal health coverage is also very important, and the international health regulation increase access to medical products. So this is also how to achieve like into access to medical products because of many people cannot access to medical products. And social, economic, and environmental determinants, this is also related to, this is also one of the priority. And in non-communicable disease, I believe that every country have more non-communicable disease now, like DM, hypertension, and others. And health-related sustainable development goal, COVID-19, not 15, COVID-19 combat also. This is the WHO leadership priorities. So how about nursing? Nursing, as we are all in the health profession and we have shortage too, but we should think about how to promote health. to achieve the global health in the future. So if in terms of nursing role, in terms of promoting health, it can be like a caregivers, because nurses also can do holistic care and can be decision maker, to use critical thinking skill to promote patient outcomes, because patient outcomes is very important to have a good patient outcome. And as a communicator, nurses can improve healthcare environment and effective communication to patient, family, and others, and health profession. Manager can be a manager of care too, because nurses take care of the patient 24 hours. So can be a manager of care and ensure cohesive care to patient. And also another important thing is nurses can do patient advocacy and to protect patient rights and also health equity too. And in terms of a teacher, nurses also can help patients to learn about their health, medication, treatment, procedure, and challenges they may face. So these are the nurses' role to promoting health, and can be one of the roles that can lead to global health in the future. So if you have time, you have a chance, you can go to read more in terms of state of world nursing 2020, so you can get some more ideas about that. Nurses can do more. This is proposed by WHO, ICN, and also Nursing Now. So these are. So why should we have to learn about global health? As we know that in terms of the education, nurses may think about how to take care of the patient in their area. But actually, nurses also should know about global health too, because as today, nursing school have very few lecture about global health in their curriculum. So we should have more. And health is become a global problem, as we see that in the COVID-19, because it's like a global problem. It's not just a country or a region anymore. And with the chronic disease, maybe a number of one killer around the globe. And also by learning more about global health research, nursing students will be better equipped to face with challenges and their unique professions. So students also should learn about global health, so they get some ideas about the other people in the global too. And also, they should know about the differences between global and international health research and identify key challenges to global health, because they may be a part of the one who take care of the and lead to the global health, and recognize the importance of information sharing in the area of global health, and also recognize the importance of previous activities in improving global health, and recognize the need for global health network to improve locally and globally. So not just locally anymore. Nurses also should know about the issues in the global level too. So how can we do it? How can we be a nurse leader in the global health? They should have knowledge, skill, and attitude as a nurse. And also, in addition, they should know the global information literacy and also global health knowledge. They all should know also evidence-based. We cannot do just routine care for the patient. If we can improve care by use evidence-based nurse leader, this will be help the patient through information sharing to improve health. And also, as we work in the global level, we should have language proficiency and also networking in the national, regional, and around the globe. And also emotional intelligence. They cannot just have IQ, but they should have EQ too, because they're going to meet with the people around the world. And as a nurse leader, they should have both EQ and IQ. Critical thinking and decision-making skill is also very important. And proactive behavioral and visionary leadership also very important. Work with others as like a teamwork Anywhere, the important thing is they should focus on ethics too, ethical rules and also moral and ethics. This is very important to work with others in the global health, to lead to global health. And also as a servant leadership may be helpful too. So in conclusion, I think that in terms of global health is really important. And we think that if we can do something to help each other, and nurses can doing some like can work together, this will be a very important part of our work as a nurses and as a nurse, and also can help people around the world in terms of global health. Yeah, so I would like to end my talk with this one. Thank you very much for inviting me here. I don't have a lot of time to talk because you give me like a 10 minutes. So I hope that you get some of the ideas of how nurses can do in the future to improve global health. Thank you very much.
Thank you very much, Professor Vepeda from Bangkok, and she was delivering a precious talk. And so kind of you, ma'am, again, for being with us. Proceeding for today's session, that's the second day of this first International Nursing Research Council, NRCON 2022. And we've also welcomed to Madam Professor Dr. Tazeen Saeed Ali, Associate Dean AKU Sonam. Thank you very much, ma'am. Ma'am, कल भी हमारे साथ थी, इनकी एक scholarly talk भी हमने सुनी थी. Thank you very much. And Madam Fakhrunissa, she is Deputy Director Nursing Sindh. Madam, आपको भी खुश आमदीद कहते हैं, Madam Fakhrunissa. Ladies and gentlemen, please be seated. And now, the speaker I'm going to call upon him is a great scholar. और उनके लिए मैं एक शेर कहूँगा कि मंजिल से आगे बढ़कर मंजिल तलाश कर, मंजिल से आगे बढ़कर मंजिल तलाश कर, मिल जाए तुझको दरिया तो समुंदर तलाश कर. वो इसी लियाकत यूनिवर्सिटी के दरिया से सैराब हुए, अपने इल्म की प्यास इसी इंस्टीट्यूट्स से बुझाई, और यहाँ से जो उनका सफ़र शुरू हुआ तो वो वहाँ तक उस दरिया तक नहीं रुके, लेकिन इल्म के समुंदर में और भी आगे बढ़ते चले गए और बढ़ते चले जा रहे हैं. और हमारी दुआ है कि वो इसी तरह से आगे बढ़ते जाएं. He is an iconic personality and he has multiple introductions. A very well-known surgeon, eminent educationist, and a dynamic administrator, as well as a philanthropist. At present, he is working as principal of Lahore Medical and Dental College, Lahore, and he has more than 70 research publications in national and international journals on his credit. It is also, he is also a huge round of applause. He is also author of many textbooks and is pioneer of medical education in Punjab, and he is also one of the chairman of National Curriculum Committee of Pakistan Medical and Dental Council. And above all, इन तमाम चीज़ों से बढ़ के जो चीज़ें हमें उनसे सबसे ज़्यादा जोड़ती है वो ये है कि he is part of LUMHS alumni. कोई निस्फ सदी कबल इसी कॉलेज, जब ये लियाकत मेडिकल कॉलेज हुआ करता था, अब लियाकत यूनिवर्सिटी ऑफ मेडिकल एंड हेल्थ साइंसेस है, यहीं के वो ग्रेजुएट हैं. और ये निस्फ सदी की लेगेसी अपने साथ लेकर, बहुत सारी यादें, बहुत सारे एक्सपीरियंसेस लेके हमारे साथ यहाँ शरीक हुए हैं. गिव हिम अ बिग हैंड, प्रोफेसर डॉक्टर अब्दुल मजीद चौधरी.
Assalamu alaikum and a very good morning to everybody. Dr. Shazia, ladies sitting on the dais, ladies and gentlemen, It's indeed a pleasure and always a pleasure to come back to LUMHS, and I'm grateful for the invitation that was extended to me by the organizers, and I hope I will justify my visit to LUMHS. Can I have the first slide, please? Well, I chose the topic of my talk as compassion and empathy, great human trait. I think this is our profession, both medical and nursing, revolves around these two traits. And I think we are lucky that we have been chosen by Almighty to serve the humanity. This is a profession that blends the rich traditions of past with ever-changing realities of today's healthcare industry. Nurses are taught and academically prepared by leaders in the nursing field who have specialized knowledge that will specifically train nurses to meet the challenges. The fundamental concept of nurses is that of providing a caring service for a fellow human being. As a most direct healthcare provider, the responsibility of the nurse is to prioritize and deliver compassionately personalized, qualitative patient care. As they say, being a nurse is a work of art. I'll just take a small little voyage through historical perspective. It started way back 300 AD, that the entry on women in nursing. And 1633, Sisters of Charity, founded by Louise de Marillac. And in 1809, Mother Elizabeth introduced Sisters of Charity in USA, later known as Daughters of Charity. And in 1860, I must salute these two ladies, Florence Nightingale and Caroline Hampton. I'll elaborate in a minute. Florence Nightingale, she introduced a school of nurses in St. Thomas's Hospital, London, where I had the honor to work in that institution as well, way back in 70s. 1890 establishment of Nurses Associated Alumni of USA and Canada later became American Nurses Association, an association of nursing superintendents in India in 1905, and creation of Trained Nurses Association of India in 1908. In 1920, graduate nurses midwifery programs were established. In 1953, National League of Nurses in collaboration with the universities developed nursing education. It became a profession in 19th century. Florence Nightingale was a well-educated lady coming from a very rich family. You know, British parents who lived in Italy and lived in city of Florence, and that's why, you know, they named their daughter after the name of the city. That's why it's called Florence Nightingale. And, you know, she was founder of nursing, and patient outcome and overall healthcare improved dramatically, you know, with the introduction of nursing. Her favorite dictum, you know, they say in medical profession, in our oath, we say non CA. It's an Italian word, means first do no harm. And that's what was her favorite dictum, that do the patient no harm. And she challenged the social norms of very conservative British society and founded many schools of nursing with theoretical and practical basis in the care of sick. And she was the first one to stress on aseptic precautions, and came from very wealthy parents, born in city of Florence. This is the lady, I think she has to be saluted. You know, the lady with a lamp. Now, there is another famous lady. She was Caroline Hampton. And she also rebelled against her family and entered nursing school in New York City. The Johns Hopkins Hospital was opened in 1889, and she moved to Baltimore and was appointed chief nurse of the operating room by the world-famous surgeon of those times, Dr. William Halsted. She developed a severe contact dermatitis. You know, in those days, there was no scrubbing, and people used to use diluted carbolic acid to sterilize the hands. And she developed contact dermatitis. And she came up with the idea that I should use the kitchen gloves. And that's where your use of gloves came into being around the world. Great contribution. You know, that's the gloves which is still in the Baltimore Museum, which she used for the first time. You know, the roles of nurses is they are caregiver, clinical decision maker, patient's advocate, case manager, rehabilitator, comforter, and very good communicator. You know, nursing is one of the oldest and most prestigious profession in the world. And you'll be surprised that the first nursing school in India was established in city of Lahore, in Mayo Hospital in 1884. And I used to teach nurses, you know, the surgery in those days, in early 80s, in that school which is still there in Mayo Hospital, Lahore. And the rules, standards, and curricula was developed in 1907, and missionaries played a very significant role in developing this profession. You know, it's important to stay up to date on current happenings on the field. The healthcare profession is a very fast-paced and constantly changing. It's important to stay educated on those changes. Luckily, there are many journals, websites, and social media pages now. And since the healthcare field is so fact-based, it's important that sources of information are trustworthy, reviewed, and factual. You know, there are quite a few worldwide. I was just wondering, I was ignorant about presence of any journals in Pakistan, but I was told there are 2 journals. And I would suggest to the LUMHS University to start off with a journal of nursing here in this institution. I think if it's not there, then it could be called Pakistan Journal of Nursing. I was just thinking aloud and thought of this. And university should enroll nurses for PhD programs. And, you know, another thing I suggested to the worthy Vice Chancellor last night, that they are doing a certificate in health professions education. And I think the nurses should be enrolled in that course. And I think it's a wonderful idea. I think probably I must congratulate the organizers. This is probably the first time ever that in this country, this kind of a conference is being organized. You know, basic nursing education is now in universities and colleges, and a growing variety of employment settings and growing emphasis on aspects of nursing that characterize it as a profession. And there is a great nursing influence on healthcare policy and practice. You know, another, I think, rather neglected field in this country is hospice care. You know, it focuses essentially on care, comfort, and quality of life of a person with serious illness who is approaching the end of life. At some point, it may be not possible to cure a serious illness, or a patient may choose not to undergo certain treatments. Hospice care prioritizes comfort and quality of life by reducing pain and suffering. The majority of staff for hospice care are nurses, and majority of patients feel quite comfortable with them in terminal stages. You know, now I think there is a wide variety of roles of nurses around the world, which is not being practiced in Pakistan as yet. You know, in the Scandinavian countries, there are anesthetist nurses, you know, who are fully in charge of the anesthesia of a patient. Before, during, and after surgery, they take care of them. They administer medications to keep patients asleep or pain-free during surgery and constantly monitor every biological function of the patient's body. I think it's an advanced nurse with a nursing, educational, and professional background. You know, this is being practiced now. There are different trends in the Scandinavian countries. The general purpose of home nursing in these countries is to prevent illness, support health promotion, and provide nursing and treatment, rehabilitation, and palliation to patients in need. And home nursing is provided to patients of all ages in cases of acute or chronic illnesses. And in all of these countries, except Finland, home nursing is provided free of charge for the patients. You know, in Holland, most of the deliveries are done at home by the nursing staff, and they are specially trained nurses. According to American College of Association of Nursing, vigorous research provides a body of knowledge that helps advance nursing practice. I think this is what this conference is aimed at. Help sharpen the health policies and contribute to global health care. It prevents disease and disability, manages symptoms of illness, enhances end-of-life care, evidence-based care improves the disease outcomes. Now, we have, I think one of the things which is missing in our country is the palliative care of the patient. The goals of palliation is essentially relief of symptoms, attainment of life goals, portability, accessibility, cost efficiency, and any thoughts of the patient which are to be taken care of. In city of Lahore, in Cancer Care Hospital, we have established a department of palliative, Institute of Palliative Care. I think it's, there have been deteriorations in social values in our country. As far as my knowledge goes, in all the big cities, there are old people homes now. Instead of looking after our parents, people with money go and dump their parents there, which is a very sad story. So keeping that in mind, this institution of palliative care has been established in city of Lahore in Cancer Care Hospital, where, people are looked after, staff is being trained how to take care of a terminally ill patient. And look, the backbone of this palliative care unit is essentially, the center point is nursing. The team revolves around nursing care. Palliative care, home programs, volunteer support, and of course, close liaison with the family physician. You learn how to lend a shoulder to somebody to cry. I think it's a great human trait. Just a simple hug can change the stance of a human being towards life. Palliative care is to provide place and rest and improve the quality of life for those terminally ill cancer patients who for some reasons can't go home. To provide a place where patient may be admitted directly to a specialized unit. One of the chief of this institution, he is son of a great Justice Hamoud Rahman. And he narrated a story that there was this lonely lady in Thailand who needed palliative care. And she said, I can't go to the hospital unless my dog accompanies me. So they had to make special arrangements for the dog of that lady to be looked after in the hospital. So it's to provide facility for short-term patients and medical treatment which can't be given at home, like a pleural tab, unable to control symptoms at home, provide respite for primary care and the family, and all these jobs are very well understood and managed by nurses. Ladies and gentlemen, in conclusion, I think we must learn to respect this profession. Uphold the professional dignity. Ensure active participation in the society. You know, Nurses Week can be used as an opportunity to recognize nurses, in practice to advertise the profession of nurses, increase its visibility, and portraying a positive image. This profession has developed over time and now holds positions of authority and stature in our modern society. And among the various rewarding community service professionals, the nursing profession is unique due to its charitable, humanistic nature. Ladies and gentlemen, I thank you very much for very patient listening. Thank you very much.
Thank you very much, sir, for your extremely impressive and motivating speech.
And now, with the permission of chair, I would like to announce the tea break. आप तमाम लोगों के लिए बाहर गर्मा गर्म चाय तैयार है और साथ ही साथ आपने ज़ाहिर कॉन्फ्रेंस है तो हम आपका एक एक लम्हा इस्तेमाल करेंगे, तो ये चाय पीते भी जाएंगे और हमारा पोस्टर्स प्रेजेंटेशंस वहाँ पोस्टर्स लगे हुए हैं, आप वो भी देख लीजिएगा. और soon after tea break and this poster presentation we are again gathering here. यहाँ पर हमारी एक और टॉक अभी मैडम पामेला मार्शल की टॉक है वो सुनेंगे, and then we'll move for the plenary sessions. So please have a tea. बाहर जाएंगे, हमारे हॉल मैनेजमेंट एंड वॉलंटियर्स विल गाइड यू. आप चाय भी पिएं और वहाँ पोस्टर प्रेजेंटेशन है तो पोस्टर्स भी देखिएगा. थैंक यू वेरी मच एंड कम सून आफ्टर टी.